Hey everybody, this is Amanda and this is my provider settings and purchasers video. Alright, so from this class we've all learned that healthcare in the United States is a complex and intertwined system based off private and public programs affected by cost, access, and quality. Understanding the healthcare system is important as a nurse because we play a role and can influence healthcare delivery and quality by being lobbyists for healthcare reform. Having poor or great bedside manner and skills also influences the quality of healthcare a person receives. Providers, settings, and purchasers are all connected in affecting the cost, access, and quality of the healthcare system. So, providers. Providers are anyone who delivers healthcare services such as doctors, nurses, nurse practitioners, phlebotomists, techs, and CNAs. Providers provide patient-centered healthcare services such as health promotion, screenings and surgery, disease prevention, administering medicines, monitoring outcomes, emergency medicine, diagnosing, and treatment. Providers can create inequity in healthcare services with defensive medicine, fee-for-service payment, and increasing the cost of healthcare, influencing access and quality of service. They increase their prices to make up for people who do not pay and to pay for new technologies obtained, such as telehealth services and CT imaging. Healthcare settings can be hospitals, urgent cares, nursing homes, outpatient services, anywhere that delivers healthcare to someone. Settings work by providing healthcare to patients in several ways. Emergency medicine, portable screening clinics, chemotherapy, outpatient, urgent cares. They provide quick services for non-urgent emergencies. First responders provide first aid and ambulances, rehabilitation services, doctors' offices, and community health units. Settings can create inequity in healthcare by only accepting private insurance for some settings, creating lack of access to healthcare. For example, freestanding ERs only accept private insurance, forcing Medicaid recipients to seek care in hospital ERs. This causes longer wait times for those patients and overcrowding ERs. Providers who accept Medicaid have long wait times for appointments, leading to a lack of availability for services and force people to seek treatment in overcrowded, understaffed ERs. Also, these settings require income to pay for their employees and have the supplies that they need to function. Therefore, their cost for service increases. Purchasers. Purchasers are individuals or an organization that buys healthcare services. Examples are employers or individuals. Purchasers such as organizations create inequity in healthcare by raising insurance premiums too high for low income or middle class to afford. Hospital services and testing are expensive, and insurance companies must pay for these. To make up for the money they spend, insurance companies increase their premiums. So we pay more because insurance companies pay even more. People are unable to afford health insurance and or do not meet the qualifications to be covered by Medicaid. This leads to an inequity in healthcare because those people do not have access to health services such as preventative medicine and primary physicians. Therefore, they seek treatment in emergency rooms, which further increases costs by providers having to make up for the care and services these patients cannot afford. This attributes to overcrowding in ERs, delays in care, and higher hospital bills because these patients are usually sicker and require longer stays in the hospital. Alright, so now we can see how this affects the entire healthcare cycle. And we can also see how this is intertwined with one component affecting the other. Providers affect the system by increasing prices. Insurance companies now must increase their prices for premiums. Purchasers pay even more for healthcare and insurance. Better quality of care is also expensive and costs insurance companies and patients more money. Patients who cannot or do not pay require doctors and hospitals to increase their costs to make up for the loss in revenue. Insurance premiums increase and now purchasers cannot afford health insurance. So no health insurance means limited or no access to health care. With no access to health care, this population is sicker and require more expensive care and lengthy and costly hospital stays. And the cycle continues.